Hi, I'm Priya from Anahat, a non-profit working in public health. Meet Arumugam, a 65-year-old waste picker. What do you think is wrong with him? I thought he had just hurt his foot when we met him. It was infected and swollen, gradually getting worse over 4 months. It wasn't just an injury. Arumugam had undiagnosed diabetes, which led to diabetic foot. Eventually, his foot had to be amputated, forcing him to stop working. Can you imagine losing a limb because of diabetes? 30 people in India get amputated every minute due to diabetic foot. Like Arumugam, many people wait until they really don't feel well before going to a doctor. The amputation could have easily been avoided had his diabetes been caught early, but he didn't have access to healthcare. We got him admitted and his surgery covered by insurance, but by the time we met him, it was too late. Diabetes leads to debilitating conditions like these, severely impacting quality of life and productivity. India is now the diabetes capital of the world. An estimated 100 million people now live with this disease. And we might think it affects only the rich, but with worsening lifestyles across the board, it impacts the poor too, much harder. Half of Bangalore's population lives in slums. Each of the city's 147 primary health centers cater to about 1 lakh people, 3x the recommended number, meaning they're under-resourced and not enough in number to cover the city's actual population. And so the poor lack access to timely public health care. The only solution is a focus on prevention, early diagnosis, and management. Anahat works to improve access to quality, affordable primary and preventive healthcare, moving away from the emergency response framework that both people and the healthcare system currently operate on. People should be able to access healthcare when they need it to avoid such extreme end results, which are entirely preventable when the disease is caught early. Anahat runs a free clinic and conducts health camps in slums in Bangalore that work in a hub and spoke model, where camp referrals come to the clinic for follow-up care. Our preventive health program focuses on metabolic diseases, chronic pain, and mental health. Our primary health program is anchored at the Anahat Clinic, where we offer free consultation with an allopathic doctor, 100 plus medicines, and 70 plus diagnostic lab tests. We see a footfall of about 2,000 patients every month. More than half have at least one lifestyle disease like diabetes, hypertension or blood pressure, hypothyroidism, respiratory, and cardiovascular disease. The first vertical in our preventive health program is Prerna, a behavior change workshop for diabetes and hypertension patients on the importance of diet, nutrition, exercise, and managing stress. We have seen dramatic improvements, with some patients even reversing the disease and being weaned off medication. Ananda is our mental health vertical. Our in-house counselor helps patients deal with stress, grief, anxiety, and conflict, also explaining the links between mental and physical health. Many of our patients are manual laborers and domestic workers who live with chronic pain. Physiotherapy helps them understand the importance of active movement in managing chronic pain. Since 2017, Anahat has impacted over 11,000 unique patients through our free clinic and health camps, with a 22-fold increase in just 7 years. We reached a further 3 lakh people during COVID, assisting the government with screenings and vaccinations. 7 out of 10 of our patients return to us for follow-up care, indicating an acute demand for our work. My mother, Rani, and I started Anahat because we had 2 sudden health scares that were life-changing. We are deeply committed to this work because we have personally experienced the impact a chronic disease can have, not just on the patient, but on the entire family. I have worked in the social sector on water, sanitation, literacy, and now public health, while Rani has worked in public health extensively, implementing primary and preventive health programs in several states when she led Biocon Foundation. India cannot achieve Sustainable Development Goal 3, good health for all, without collaboration. Help us double our reach to 6,000 patients this year through our free clinic and health camps at a cost of just 3,500 rupees per patient per year. What you might spend on a family outing. That's what it costs to prevent what happened to Arumugam and millions of others like him, the people who clean our streets and homes, cook for us, pick up our waste, from happening again. Let's work towards a future where good health becomes our nation's ultimate wealth. Thank you.